Do your legs feel heavy, stiff, or achy, especially after walking or standing for a while? You're not alone. For millions of people over 60, leg pain becomes a daily challenge, making it harder to stay active, sleep comfortably, or enjoy everyday life. But here's the good news. Not all leg pain is just part of getting older. In fact, most causes can be managed, and in some cases even reversed, with simple, natural steps. In this video, we're going to break down the top 5 causes of leg pain in seniors, and reveal the natural remedies that can bring real relief without relying on heavy medications or invasive procedures. So grab a cup of tea, sit back, and let's get into it. Poor circulation, peripheral artery disease, what it is and how to fix it. Naturally, poor circulation is one of the most overlooked but impactful causes of leg pain in seniors. The condition known as peripheral artery disease, PAD, is the most common culprit. PAD happens when fatty deposits, plaque, build up in the arteries, narrowing them and restricting blood flow, especially to the legs and feet. This reduced circulation can lead to muscle fatigue, cramping, and pain during simple activities like walking or climbing stairs. One telltale sign of PAD is intermittent claudication, which refers to leg pain that appears during physical activity and disappears with rest. Many seniors brush this off as a normal part of aging, but in reality, it's a sign that the legs aren't getting the oxygen-rich blood they need. If left untreated, PAD can increase the risk of ulcers, infections, or even amputation. In severe cases, that's why early identification and action are so important. Now for the good news, PAD can be improved and even reversed with natural strategies. One of the best remedies? Walking. Regular walking actually prompts the body to create new blood vessels, improving circulation over time. It might be painful at first, but starting with 5 to 10 minutes a day and gradually increasing can make a huge difference. Your diet is another powerful tool. Consuming omega-3 fatty acids from sources like salmon, sardines, flax seeds, and chia seeds helps reduce inflammation and promotes better blood flow. A handful of walnuts or a spoonful of flaxseed in your morning oatmeal is an easy daily habit to adopt. Turmeric is another standout. This golden spice contains curcumin, a natural anti-inflammatory compound that helps relax blood vessels and improve endothelial function. Pair it with black pepper to enhance absorption and enjoy it as tea or in soups and curries. Don't underestimate the power of hydration either. Thickened blood due to dehydration can worsen circulation. Aim for at least 6 to 8 glasses of water daily and avoid too much caffeine or alcohol, both of which dehydrate the body. Elevating the legs for 15-30 minutes a few times a day also helps blood flow back to the heart. This is particularly useful if you've been sitting or standing for long periods. Lastly, consider compression socks, which gently squeeze the legs to promote venous return. These are especially helpful for seniors who travel or sit for long. Stretches. If you're experiencing cold feet, shiny skin on the legs, or slow healing wounds, don't delay a doctor's visit. PAD can be diagnosed easily with a simple test and often managed effectively with lifestyle changes. To sum it up, poor circulation isn't just a nuisance, it's a warning sign. But with consistent natural habits like walking, anti-inflammatory foods, hydration, and leg elevation, you can dramatically improve blood flow, reduce pain, and get back to doing what you love. Sciatica, sharp, radiating pain, and how to manage it naturally. Sciatica is another major cause of leg pain in seniors, and it's one that can feel particularly alarming. Unlike muscle soreness or joint aches, sciatica creates a distinct, sharp, radiating pain that travels from the lower back or buttocks all the way down one leg, often reaching the calf or foot. It can feel like shooting electricity, burning, or tingling. Some people also report weakness or numbness in the leg. This pain is a result of irritation or compression of the sciatic nerve, which is the largest nerve in the body. In older adults, herniated discs, spinal stenosis, or degenerative disc disease are common causes of sciatica. As the spine naturally compresses and the discs lose water with age, nerve roots can get pinched or inflamed. Long periods of sitting, poor posture, and even certain movements can aggravate the problem. Now, while some cases of sciatica may require medical intervention, many seniors find natural relief through gentle and consistent lifestyle changes. One of the most effective ways to manage sciatica naturally is through gentle stretching and yoga. Targeted poses like child's pose, knee-to-chest stretch, and piriformis stretch can help release pressure on the sciatic nerve. It's crucial to avoid sudden twisting or deep bending. Instead, focus on slow, controlled movements to lengthen the spine and ease nerve pressure. Posture correction is also critical. Many seniors develop poor spinal alignment from years of slouching or sitting on soft furniture. Simple adjustments, like sitting upright with a small pillow supporting the lower back, can reduce pressure on the sciatic nerve. Standing desks or ergonomic chairs also help maintain better spine health. Heat and cold therapy offer immediate, drug-free pain relief. A warm compress or heating pad applied to the lower back can relax tight muscles that may be compressing the nerve. Alternating with cold packs helps reduce inflammation and nerve irritation. Try 20 minutes on and 20 minutes off 2 to 3 times a day. Adding anti-inflammatory foods to your diet is another powerful tool. Turmeric, ginger, leafy greens, blueberries, and fatty fish like mackerel or sardines help lower systemic inflammation. These foods work from the inside out to reduce the intensity and frequency of sciatic flare-ups. Some seniors also find relief through massage therapy, especially techniques that target the lower back and glutes. A licensed therapist can release tight muscles like the piriformis, a small muscle deep in the buttocks that often presses on the sciatic nerve. For ongoing management, consider natural supplements like magnesium, which supports nerve health, or B vitamins, especially B12, which helps repair and nourish nerves. Always consult a healthcare provider before adding supplements to ensure safety with your medications. Finally, don't underestimate the value of daily walking. While it may seem counterintuitive when you're in pain, movement promotes healing. By increasing circulation and releasing endorphins, the body's natural painkillers. In summary, sciatica can be frustrating and painful, but many seniors can manage it effectively without relying solely on medications. With the right stretches, posture habits, anti-inflammatory foods, and regular movement, you can relieve pressure on the sciatic nerve and regain your mobility naturally. Arthritis, chronic joint inflammation, and natural approaches to relief. Arthritis is one of the most common causes of leg pain in seniors, particularly in the knees, hips, and ankles. It's not a single disease, but a broad term that covers over 100 different joint disorders, with osteoarthritis, OA, being the most common type affecting older adults. In osteoarthritis, the cartilage, the protective tissue cushioning your joints, gradually wears away, causing bones to rub against each other. This leads to inflammation, stiffness, swelling, and pain. Another type, rheumatoid arthritis, RA, is an autoimmune condition where the immune system attacks the lining of the joints, leading to chronic pain and potential joint deformity. Regardless of the type, arthritis significantly impacts mobility, independence, and overall quality of life in seniors. But here's the good news. You can ease arthritis symptoms and slow its progression with natural strategies that reduce inflammation and strengthen the joints. The first and most effective remedy? Movement. While arthritis can make exercise seem daunting, low-impact activities like walking, swimming, tai chi, or cycling can help maintain joint flexibility and build the muscles around the joints for better support. Even just 15 to 30 minutes, if gentle movement per day, can reduce pain and stiffness significantly over time. Next is weight management. Extra weight puts added stress on weight-bearing joints like the hips and knees. In fact, every pound of excess weight adds about 4 pounds of pressure to your knees. Losing just 5 to 10% of your body weight can lead to noticeable relief from joint pain. Focus on a nutrient-dense diet rich in anti-inflammatory foods like berries, leafy greens, olive oil, nuts, and fatty fish. Turmeric once again shines as a natural anti-inflammatory agent. Curcumin, its active compound, has been shown in multiple studies to reduce joint inflammation and pain in arthritis sufferers. A daily turmeric supplement, or adding the spice to soups and smoothies, can provide gentle, long-term relief. Incorporating omega-3 fatty acids from fish oil or plant-based sources like chia seeds and walnuts also helps reduce joint stiffness. These healthy fats work by decreasing the production of inflammatory chemicals in the body. Topical remedies can provide fast relief. Capsaicin cream, derived from chili peppers, is a popular natural option that blocks pain signals. Applying it to the affected joints 2 to 3 times a day can gradually reduce discomfort. Hot and cold therapy also plays an essential role. A warm bath, heating pad, or hot towel can loosen up stiff joints, while ice packs reduce swelling and inflammation after activity. Alternating between hot and cold can be especially effective. For those interested in supplements, glucosamine and chondroitin are widely used for osteoarthritis. They are thought to help rebuild cartilage and reduce pain, though results may vary between individuals. Always talk to a healthcare provider before starting any new supplement. Finally, managing stress is crucial. Chronic stress increases inflammation and can worsen arthritis symptoms. Techniques like deep breathing, meditation, or gentle yoga can help calm the nervous system and lower pain levels. In conclusion, arthritis doesn't have to define your golden years. Through a combination of gentle exercise, a clean anti-inflammatory diet, natural remedies, and stress management, seniors can take control of their joint health and enjoy a more active, pain-free life, without heavy dependence on medication. Muscle loss, sarcopenia, why weak muscles cause leg pain and how to rebuild naturally. Muscle loss, medically known as sarcopenia, is a natural part of aging that often begins as early as age 30 but becomes more significant after 60. By the time seniors reach their 70s and 80s, they may have lost up to 50% of their muscle mass. This gradual weakening affects balance, stability, and endurance, and it's a major contributor to leg pain in older adults. Why does sarcopenia cause leg pain? Muscles act like shock absorbers and stabilizers for your joints and bones. When those muscles shrink or weaken, it puts more stress on the joints, tendons, and ligaments. Everyday activities like climbing stairs, standing from a seated position, or even walking can become painful. Weak muscles also lead to poor posture and gait changes, further contributing to strain and discomfort in the lower body. But here's the good news. Muscle loss is not irreversible. In fact, with the right natural approach, seniors can rebuild and maintain muscle strength well into their 70s, 80s, and beyond. The most effective weapon against sarcopenia is resistance training. You don't need to lift heavy weights. Even simple exercises using body weight or resistance bands can stimulate muscle growth. Exercises like squats, leg raises, wall sits, and step-ups can work wonders for strengthening the legs. Start with just 10 minutes a day and gradually build up as your strength improves. Protein intake is also key. As we age, our bodies become less efficient at turning protein into muscle. Seniors need more protein than younger adults to maintain their muscle mass. Aim for 20 to 30 grams of protein per meal, from sources like eggs, lean meats, lentils, Greek yogurt, and tofu. Pairing protein with some form of movement boosts muscle building even further. Another helpful nutrient is vitamin D, which supports both muscle function and bone health. Many seniors are deficient in vitamin D due to reduced sun exposure. Natural sources include sunlight, 15-30 minutes a day, fortified foods, fatty fish like salmon, or supplements. Creatine is another natural compound that may benefit older adults. Often associated with athletes, creatine helps with short bursts of energy and muscle recovery. New research shows that it may help seniors regain lean muscle mass and improve mobility, especially when paired with resistance training. Anti-inflammatory foods like berries, turmeric, and leafy greens are important too. Chronic inflammation speeds up muscle breakdown, so keeping inflammation in check supports your rebuilding efforts. Don't overlook hydration. Dehydrated muscles are more prone to cramping and injury. Aim for at least 6-8 glasses of water per day, especially after exercise or time in the sun. Lastly, ensure you're getting enough sleep. Your muscles repair and grow while you sleep, making rest just as important as diet and exercise. In summary, muscle loss is a natural part of aging, but it doesn't have to lead to pain and weakness. With strength-building exercises, proper nutrition, and smart lifestyle habits, Seniors can restore muscle strength, reduce leg pain, and regain independence, all naturally. Nerve damage, neuropathy, tingling, burning legs, and natural support for nerve health. Nerve damage, commonly known as peripheral neuropathy, is another leading cause of leg pain in seniors. This condition affects the peripheral nerves, the i.e. vast network of nerves outside the brain and spinal cord, especially in the legs and feet. Neuropathy often causes a variety of uncomfortable sensations, such as tingling, burning, numbness, stabbing pain, or a pins and needles feeling. It can also result in weakness, balance issues, and difficulty walking, increasing the risk of falls. The most common cause of peripheral neuropathy in older adults is type 2 diabetes, but it can also be triggered by poor circulation, vitamin deficiencies, alcohol abuse, certain medications, or autoimmune diseases. Regardless of the cause, nerve damage can be persistent and frustrating. But there are natural strategies that can provide relief and even help repair nerves over time. One of the most important natural approaches is blood sugar management. For seniors with diabetes or even prediabetes, high blood sugar levels can damage the nerves and blood vessels that support them. Reducing sugar and refined carbohydrates in the diet is key. Focus instead on complex carbohydrates like sweet potatoes, oats, and quinoa, lean proteins, and plenty of vegetables to keep blood sugar stable. In addition to dietary control, the vitamins, especially B1, thiamine, B6, and B12, play a critical role in nerve health. A deficiency in these vitamins can directly lead to or worsen neuropathy. Seniors are particularly at risk of vitamin B12 deficiency, which can mimic the symptoms of nerve damage. Natural sources of B12 include eggs, meat, dairy, and fortified cereals. For vegetarians or those with absorption issues, B-complex supplements or sublingual B12 may be beneficial. Alpha-lipoic acid, ALA, is another powerful antioxidant used in Europe and the US for neuropathy treatment. It helps improve nerve function and reduce burning, tingling sensations. Studies have shown that 600 mg per day of ALA can significantly ease neuropathic symptoms over time. Acetyl L-carnitine is another supplement that supports nerve regeneration and pain reduction. Anti-inflammatory foods should also be part of the daily diet. Chronic inflammation worsens nerve damage and contributes to pain. Add foods like turmeric, ginger, salmon, olive oil, leafy greens, and blueberries to your meals. These help combat inflammation naturally and support overall healing. Gentle exercise is also beneficial. While it may seem counterintuitive to move when your legs burn or tingle, walking, stretching, and Tai Chi can increase blood flow, which nourishes the nerves and promotes healing. Aim for at least 20-30 minutes of light movement per day. Foot care is essential for those with leg or foot neuropathy. Inspect your feet daily for injuries or changes in color, since nerve damage can dull your ability to feel cuts or blisters. Wear cushioned, well-fitting shoes and avoid walking barefoot. Lastly, stress management is important. Stress can amplify pain perception and worsen symptoms. Practices like deep breathing, meditation, or soft music can help lower stress hormones that negatively impact nerve function. In conclusion, while nerve damage can be persistent, seniors can often find significant relief with a natural, holistic approach. With better blood sugar control, nerve-supporting nutrients, gentle exercise, and anti-inflammatory foods, it is possible to reduce the discomfort of neuropathy and improve quality of life, naturally and safely. Let's quickly recap what we've learned today. Poor circulation, focus on walking, omega-3s, and turmeric. Sciatica, stretch, apply heat, and load up on magnesium-rich foods. Muscle loss, add protein and daily movement to your routine. Arthritis, embrace an anti-inflammatory diet and low-impact exercise. Neuropathy, control blood sugar and nourish your nerves with vitamins and ALA. And don't forget the power of water to support everything from blood flow to joint function. You don't have to accept leg pain as your new normal. These natural solutions are simple, accessible, and proven to help. Start small, stay consistent, and you may be amazed at how much better your legs and your life can feel. If you found this video helpful, hit the like button and share it with a friend or loved one who might be struggling with leg pain. And for more natural health tips for life after 60, don't forget to subscribe and turn on notifications. Thanks for watching, and here's to stronger, healthier legs, naturally.